Hi everyone, it's Dr. Nabila Noor, board-certified urogynecologist and a pelvic reconstructive surgeon. I recently posted a video where I talked about how sex should improve after pelvic organ prolapse and incontinence surgery. Having said that, there are some women who will notice that sex hurts after these surgeries. Why is that? There are various reasons for it. Number one, pre-existing pelvic pain or myofascial pain. There's some women who have something called myofascial pain where their pelvic floor muscles are very tight. So for these patients, the trauma from surgery or the act of cutting into that area when they already have a pre-existing pain can make that pain worse. So for my patients with any kind of pre-existing pelvic pain, I do talk to them about considering pelvic floor PT, considering some pelvic floor relaxation exercises so that their symptoms can be managed better after surgery. Number two, engaging in intercourse prematurely. Usually after surgery, we recommend pelvic rest for about 6 to 8 weeks, depending on how extensive the surgery was, which essentially means no vaginal penetration, no sexual intercourse, and of course nothing in the vagina. If you have a patient who engages in sex prematurely while the tissue is still healing, that can be really uncomfortable, especially because the stitches that we use takes about 6 weeks to dissolve. Similarly, there can be swelling in the vaginal area as well, so engaging in intercourse before that area has healed can be really uncomfortable. Number four, vaginal atrophy. For many of my perimenopausal or menopausal patients, their tissue is very atrophic or thin or friable. What that means is, with penetration and with the friction, the tissue can be irritated. Now, usually the way I treat these patients is starting them on some vaginal estrogen even before the surgery so that the tissue has some time to heal and help improve outcomes for the future. Finally, if the vagina is too tight, patients can have pain with intercourse. These are more for patients who are undergoing prolapse surgeries, specifically vaginal prolapse surgeries. Sadly, I do see this still. The patient underwent a pelvic organ prolapse surgery with somebody who may not have had adequate training or adequate experience, and they took out a lot of the vaginal tissue so that afterwards patients notice that their vaginal opening is very tight and they have a lot of scarring and the vagina becomes very stenotic, which essentially means there's not a lot of flexibility because there's not a lot of adequate tissue. This is a very unfortunate situation because once that tissue has become very stenotic, it's very difficult to treat that, which is why it's really important to make sure you find the right surgeon